This video will cover part 2 of chapter 6, Health Psychology, for PSY 120, Careers in Psychology, Neuroscience, and Human Development. In this part of the chapter, we're going to look at bachelor's degree opportunities if you are interested in that interaction between health and wellness and psychology. There are lots and lots of pathways that you could take that don't require an advanced degree. So we'll start with recreational therapists. Recreational therapists work on assessment and planning and coordination of recreational activities in a variety of different environments. It can include things like drama, music, sports, lots of other kinds of recreation that are designed to have an impact physically, socially, and emotionally for people. Now, typically, these are people with physical or psychological disabilities. Recreational therapists typically work as part of a team, so they're going to work with health professionals like physicians, nurses, but also mental health professionals like psychologists, social workers, physical therapists, and occupational therapists. They work in a lot of different settings. They can be in community-based programs, in medical settings, parks and recreation, special education programs in schools, adult living programs, lots of different settings. At the present time, like if you wanted to get a bachelor's degree with a major in recreational therapy, that's a rarity. So as your authors point out, there are fewer than 70 bachelor's programs specifically in recreational therapy. So if you're interested in doing this kind of work, having a psychology degree and relevant coursework can help you to move into that career path. So the recreational therapist is going to work on developing plans, developing activities, and then implementing those activities. There is a national organization if you're interested in this kind of work. The National Council for Therapeutic Recreation Certification does offer a Certified Therapeutic Recreation Specialist designation. Currently, there isn't licensure, but having these certifications coming from a national organization can enhance your opportunities to get positions in these roles. Community health workers, these are individuals whose work can be defined in a lot of different ways, but basically their goal is to help individuals, help families connect up with basic services, health-related services, social services, accessing the care that they need within their community. So a lot of what community health workers are going to be doing is being out in the field, interacting with people, making sure that they are aware of services that they can access. Sometimes they will be employed in healthcare settings and in social service settings, working with other kinds of practitioners like registered nurses, social workers, counselors, and so on. So they may be kind of like that allied person who, say, you're seeing a mental health counselor for your anxiety and depression, and it becomes clear that you're having trouble accessing health care. They may reach out to the community health worker who can talk with you to help you identify resources that you can use in the community. Community health workers, those positions typically require a high school diploma, but employers are moving in the direction to preferring at least some level of college education. So either a 2-year degree or a 4-year degree. Now, as I said, though, some community health workers are actually employed straight out of high school. So, really do your homework, look at what is needed in those positions. Some states, and this is, again, the need for doing your homework, some states require formal training and certification. Some require an advanced degree, some do not. So you have to kind of look at the specific job description and the requirements that are built into that job description. A lot of what community health workers are going to do is outreach. So they may be doing home visits. They may help people understand what services are available. They may help individuals and families get housing, get food, get mental health support, all kinds of stuff. They may provide programming, like providing health education programming. They may be trained to do basic health screenings. So asking people questions and then making recommendations. High quality community health workers are going to have really close ties to the community and understand the different components of their community and what different needs they have based on who they are. Health education specialists, like the job description we just talked about, they have a lot of outreach responsibilities and a lot of community education responsibilities. They hone in really specifically on teaching individuals and people in the community about living a healthy life, how to prevent illness, how to maximize wellness, and otherwise promote health. So they may be sharing information about diet, about nutrition, sleep, exercise, risky behaviors like substance use and abuse problems, and general hygiene. You can find health educators in a lot of different contexts. My first interaction with a health educator was when I was teaching. I teach human sexual behavior, and I've often partnered with a health education specialist to provide information on STD identification, prevention, treatment, and various birth control techniques. So that's a concrete example of a health education specialist in that space. Typically, a bachelor's degree is going to be expected. There are some universities and colleges that have bachelor's degrees in health education or health promotion. That varies tremendously from one university to the next. So some people will go in the direction of getting a psychology degree or a public health degree, or even a sociology degree, and then moving in the direction of becoming a health education specialist. Individuals who have gotten the required level of coursework and in a specific education program for health education may have to go on and complete a competency exam to be certified. And in most states, they're moving pretty strongly in the direction of requiring these credentials for providing information to the community. So what health education specialists are going to be doing is teaching classes, instructing individuals, families, people in the community about health and wellness practices. They may collaborate with healthcare professionals and other kinds of organizations to implement programs and interventions in specific situations. Like during COVID, there were health education specialists who were kind of deployed out in the community to encourage people to understand testing and to engage in testing when they felt ill. And then also as vaccines rolled out, health education specialists were employed to communicate with the wider community, to go into public spaces and educate people as to what vaccines could and could not do for them. They may also participate in evaluation work, looking at the effectiveness of health education programs and interventions. They may work to specifically identify the needs of diverse community members. Health and illness very much vary depending on things like socioeconomic status, access to health care, access to good foods, and so on. So health educators may be involved with targeting those specific communities to meet their needs. And finally, they may be providing training and support to other community health workers so that they can deliver effective health care and health education. Rehabilitation techs and physical therapy aides are another career path that's typically at the bachelor's level. Rehabilitation technicians and physical therapy aides, meaning that there are rehabilitation therapists who have a higher degree of education. The technicians will work with the therapist to actually treat patients and clients. Physical therapy aides, same goes. So a physical therapist has a higher level of education. The physical therapy aide will work to help them enact their plans with actual patients. These are individuals who typically work in medical settings. They may be in rehab centers. So say a person goes in and has like I have a neighbor who had a bout of pneumonia. He has complex medical needs, and he needed to go to a rehabilitation facility for, I think it was about 2 weeks after he was discharged from the hospital, because he still needed care that was beyond what his partner could provide for him at home. And he needed equipment that he didn't have access to at home. And some of the people who worked with him were rehab techs and physical therapy aides, like helping him to get up, get walking, use his walker, and so on. So the rehabilitation aid, the titles, rehabilitation aid and physical therapy aid, are often interchangeable. They typically have the same kinds of basic responsibilities, and it may vary from facility to facility what language they're using. Rehab technicians are found in a variety of healthcare settings. They work with a lot of different kinds of medical professionals and may deliver a wider variety of tasks than PT aides. So physical therapy aides may be very much restricted to deploying tasks or treatments that their physical therapist supervisor tells them to do. Rehab technicians are more generalist, so they may be working in a wider range of contexts. Physical therapy aides tend to be in physical therapy clinics or PT departments, and that just reinforces the specificity of their work. Becoming a technician, a rehabilitation technician, or a physical therapy aide, it's going to require at the very least a high school diploma and some on-the-job training. The bachelor's degree is increasingly preferred. So what tends to happen is you may have a job posting that comes out and it clearly will identify that the bachelor's degree is preferred. We're starting to see that more often with these kinds of positions. Patient advocates are individuals who help patients understand better the medical care environment. If you've ever been involved in as a patient or as a family member of a patient who has complex medical needs or even just straightforward ones, you know some of the difficulty that process involves. So they serve as a liaison. They listen to patients, understand their concerns and needs. They communicate the patient's concerns and needs to healthcare providers. So they're kind of a liaison. They can talk to doctors and medical staff. They can also then, share information the other direction, educating patients about their conditions and so on. Patient advocates are found in a lot of different medical settings. More often, you're going to find them in hospitals and rehabilitation centers, in nursing home facilities. They may also work in insurance companies, nonprofits, and government to help people to navigate complex medical systems. Since our healthcare system in the United States is what it is, patient advocates can perform a really critical role in helping patients and their families understand the complexity and how to navigate all of those complexities. having the ability to help patients and their families understand what's going on, but also how to navigate the insurance process is critically important. Now, this field is relatively new, so the idea of credentialing is still evolving. At first, a bachelor's degree in psychology or a health-related field was assumed to be the prerequisite. Having some experience, such as an internship in a related context, gives you some entry-level training. There is movement in the direction of requiring certification. So becoming a board-certified patient advocate can document what you know and show that you have advanced training and competency in the field. So that credentialing is becoming more expected over time. Patient services representatives are individuals who, they're sometimes called patient access representatives. They're often the first person that patients will talk to at a medical facility. So they're kind of that front-end person who's going to collect some information about your status, your appointment, your records, and so on. They're going to work with patients frequently who are unhappy, who are anxious, who are sad, who are distressed, and fearful. So that patient representative is often the frontline provider who's going to deal with people who are on their worst, having their worst day, or their worst week, or their worst year, whatever. So that's an obvious, connection to the study of psychology, where you have to have good person skills, good interpersonal skills, good crisis management skills, in order to help people work their way through the process of often very, very stressful medical procedures and medical experiences. The qualifications for becoming, misspelling there, sorry about that. It's a patient representative, not a patent representative. They vary from employer to employer and employment setting to employment setting. So you have to really look at the ads and look at what is required. Most require a minimum of a high school degree. In some positions where there's greater patient contact and more complex interactions with patients, they may prefer a bachelor's degree. So again, you need to check what's expected in the job description as you pursue this kind of work. What kind of coursework may be beneficial for you if you're seeking out these kinds of bachelor's level careers? Abnormal psychology and psychopathology can be helpful. Biopsych can be helpful, especially if you're in the medical space. Cognitive psych, developmental psych, health psych, counseling, ethics, neuropsych, etc. If your school offers additional training in substance abuse, that can also be very helpful. Elective coursework outside of psychology. Working in the medical world, it deals with a lot of records. You're looking at charts, you're looking at people's information. It may be helpful for you to have some of that biology background, so anatomy, biology, chemistry, but also, things like bioethics and ethics in general. If your university offers health education courses and nutrition and public health courses, that can also be helpful. Applied experiences, any kind of volunteer or internship experience in a medical setting can be beneficial. Your authors give you a whole list of possible things, like working in health centers, hospice or palliative care, hospitals and medical centers, mental health clinics, physical occupational therapy clinics, and so on. So any kind of applied experience in that space can be really helpful. Research type of experiences as an undergraduate, seek out your any of your faculty who have health psychology as a part of their research interests. For instance, at Mount Union, Dr. Knepp, a lot of his research is in the area of health psychology. You can also look for faculty whose research is in the area of wellness and health-related behaviors, risky behaviors like substance use issues, unsafe sex, other specific examples, things like sleep problems, behavioral decision-making that is connected to health. For example, exercise and nutrition. And that concludes part 2 of chapter 6.